Yeah, we have a lot of fun, and I feel very, very fortunate to have the associates here at St. Vincent. Everyone here just chips in, rolls up their sleeves, and they love to give back to the community.
It's fun. I'm a people person, and I like people, and I like talking to people.
Today we are screening people for their blood pressure, also checking their BMI, which is body mass index, to see if they're potentially overweight, and just kind of doing a general questionnaire to see if there's any risk factors.
Of all the things you could have done here at the fair, what brought you here?
Because I always come to this tent every year to check out annually what my blood pressure is, and because I'm concerned about my health. This is a great idea. My wife's here.
We've come for like 15 years in a row.
So what did you just have done here with Dr. Spear?
I had my blood pressure taken and my pulse. You get great advice from all these people, so it's just a wonderful thing for people to stop by.
I found out that I have low blood pressure, but that's pretty normal for me.
Yeah.
And I'm healthy.
What brings you back?
Tradition.
This is a great break to get out of the office, for sure. Yeah, and it's a nice kind of relaxed atmosphere, but it's a good opportunity.
Women of Hope is an initiative of women and men who are raising money for cancer, for all cancers, for St. Vincent Foundation.
So what happens with all the money you raise with this walk?
Well, with this walk and with this initiative, the money that we raise is going to go to the St. Vincent Cancer Care Patient Navigation System and lots of different initiatives within St. Vincent Cancer Care. Everybody who walks by our booth has a story to tell about somebody that's been touched with cancer in their family or within their community.
So what are you guys doing here today at the State Fair?
Well, we want to represent that we have a mobile unit. We go around mostly central Indiana, and 5 days a week we go to some health fairs.
We are making child identification cards in case anything ever happened to any kid. They have all their information in one spot and ready to go. Big smile, big smile. So it's just one less thing to have to worry about.
And what kind of information are you taking on all of them? What goes on all these cards?
We just take their address, date of birth, we get their height and their weight, a thumbprint, a picture, their parent information, and doctor information.
Their thumbprint, all this comes out on that card, right?
Yes, it does.
And what do these kids do with these cards when they go home?
The kids, actually, we don't recommend that the kids keep them. We recommend that the parents keep them so that they have them in case of an emergency. We really do get a great response from this. A lot of parents really love having the ID cards, not only just to have that picture to carry around in your wallet, but just to have that peace of mind that if anything happened, you have it with you.
We are out here at Prevention Parkway, and Peyton Manning Children's Hospital has a couple of booths, and we're teaching kids and their families about better health and educating them on safety issues around the house.
So what is this house behind us? What's in here?
This is a house that has inside of it this cylinder, and this cylinder is the same size as a child's windpipe. And so these represent the different areas of the house and where there might be choking hazards. So you can see in here, something that you wouldn't think is a choking hazard is a makeup sponge that fits right in there and can block the windpipe.
What about this other station? I see this skinny or fat. What's that all about?
Those are fat tubes that show the fat content of different foods, and you can compare, for example, the amount of fat in a French fry compared to a potato. And it's pretty eye-opening, especially here at the State Fair, portion size and how much fat is in these beautiful fried veggies and fried fruits along the way.
Have you talked anybody out of going any further into the Midway?
Hopefully they're making better choices.
When people are walking around with the Krispy Kreme burgers, those aren't exactly Project 18 approved, so it's a little bit different than what we promote at St. Vincent Health. But you know what? It is tasty and it's good in moderation. So it's really good people watching here as well.
A lot of medicines look like candies today. For example, gummy bears. They have the gummy bear vitamins. We have a display to teach kids the difference between candy versus medicine and how it can be confusing, and that's why you should always go to a parent if you don't know what something is.
Well, up at St. Vincent Medical Center Northeast, we're really excited about an expansion that's on its way. We're actually breaking ground. Right now, we're a 24/7 freestanding emergency room with physicians' offices and some outpatient services. But in late September 2011, we're breaking ground on a new hospital. We're going to have 40 inpatient beds. We're going to be a full-service hospital. will be open December 2012. So we're very excited to be bringing this to the Fishers community, and looking forward to all the new things to come there. So yeah, we're here to meet the needs of the community, and the expansion to have an inpatient full-service hospital will help the Fishers community. Our motto is Spirit of Caring, and you see it firsthand when you're out at events like this, and we have a lot of fun, and it's just part of our mission is to give back to the community. But yeah, they're very appreciative of the information that we provide, and we're happy to be able to be in a position to give that information and fit that need.
I would ask the whole unit to come out and enjoy it because it's really fun.